Hello everyone, I'm Dr. Pranjali Gadgil. I'm a breast disease specialist and breast cancer surgeon at Jupiter Hospital. Today we are going to review some frequently asked questions about breast cancer risk. What factors affect your risk of breast cancer and what can you do actually to lower this risk? So the first question when it comes to risk is always, well, if you don't have a family history, can you still get breast cancer? Are you at risk? And the answer is yes, because 85% of breast cancers actually occur in women who do not have any family history or genetic basis for having that breast cancer. So even if you don't have a family history, it's really important that you continue to undergo regular breast exams. Now, what if your mom had breast cancer? You have a close blood relative who has breast cancer, and that certainly increases your risk compared to a woman who has no family history. And there are certain factors that will help us gauge the extent of this risk. For instance, what age did your mom get breast cancer? Was it a triple negative or some other type of breast cancer? Are there other family members affected with cancers? And that would help us guide you on whether you need to undergo genetic counseling and testing or just regular screening exams. So certainly this history needs to be brought to the attention of your breast specialist. Now, what about relatives of your father's side? Say your paternal aunt, your father's sister had breast cancer. Is that relevant? Well, yes, it is, because ultimately 50% of our genes are inherited from our moms and 50% from our dads. So even your history on your family history on your father's side is just as important and needs to be discussed when you come in for your breast exams. Now, sometimes we see this pattern of a very strong family history, and we know that 5 to 10% of breast cancers actually are genetic. And we suspect this pattern when we see multiple family members being affected, when we see young breast cancer, when we see male breast cancer. Oftentimes breast and ovarian cancers run together in families. So if you have this kind of a pattern, certainly we would advise you to undergo genetic counseling and then genetic testing. And let's say we identify this gene that runs in your family, we can test to see whether you've actually inherited it, because that probability would be 50-50. And so if we find that there is a gene that runs in your family but you haven't inherited it, then your risk of developing breast cancer is just as much as any other average woman in the population. And in this case, genetic testing actually helps you reduce your fears about this family history and risk. Now, through this process of genetic testing, what if you do get diagnosed with a harmful gene mutation? And we know that BRCA1 and 2 are the most common genetic mutations that are responsible for hereditary breast cancers. So, women who do have a harmful BRCA mutation may have a breast cancer risk as high as 60 to 80%, and the risk of ovarian cancer may be as high as 40 to 60%. And there are certainly options that we have to reduce this risk. So depending on your age, where you're at with your family planning, we help you select what's the right option for you. And this could involve an intense screening regimen where we're screening you for breast cancer every 6 months, for ovarian cancer yearly, or we may offer you medicines that may help lower your risk. And in some patients, we may even discuss preventive surgery for ovarian and breast cancer, which is the most effective way to lower your risk. So genetic testing is clearly something that needs a lot of counseling, and it's important that you talk to a breast specialist, oncologist, or genetic counselor that has experience in this field. Now, there's very little that we can do to actually reduce our genetic and familial risk. But the part that we can modify is our lifestyle and lifestyle-related risk factors. And the most important in this is exercise. Now, exercise certainly helps lower your risk of breast cancer by up to 20%. So generally, we advise women, if you're doing a light exercise routine like brisk walking or yoga, certainly put in something close to 150 minutes spread over a week. If you're doing moderate intensity exercise like a game of tennis, a jog, you're advised to put in at least 75 minutes spread over a week, and that will significantly lower your breast cancer risk. Another important factor is diet. We know that fatty diets can lead to women being overweight, and being overweight itself is a risk of breast cancer. And this is also true for young girls who are, if they are overweight at the time of puberty, they are actually at risk of developing breast cancer later in life. So we advise women to, have a healthy, balanced diet plan which has high proportion of fruits, vegetables, and legumes, and less of processed meats and fatty foods. So what about alcohol? We used to think that when it comes to breast cancer risk, moderate amount of alcohol is okay, but that is no longer true. Now we do know that even small amounts of alcohol consumption, say a glass of wine every day, does increase your breast cancer risk compared to someone who doesn't drink at all. So yes, alcohol increases your risk of breast cancer. Now, what about antiperspirants and deodorants? Well, there is absolutely no conclusive evidence to suggest that these deodorants or antiperspirants cause breast cancer. It is important to remember, however, on the day that you're going for your mammograms, do not apply any aluminum salt containing antiperspirants or talcum powder, because that actually can cause some specks on your mammogram that may confuse the reporting. Now, what about the type of bra? There's a lot of theories on the internet about how bras might affect lymphatic circulation and black bras might absorb radiation. There is absolutely no scientific basis for any of these theories, so the type of bra does not affect your breast cancer risk at all. Now, what about breastfeeding and breast cancer risk? We do know that for every 12 months that a woman breastfeeds, her breast cancer risk actually drops by 4%. So breastfeeding is certainly encouraged for benefit of both the mother as well as the baby. It is important to remember, however, that just because you have breastfed doesn't mean that you are completely immune to breast cancer. In fact, some types of breast cancer develop during pregnancy and breastfeeding as well. So it's important even for young women to be vigilant about their breast health. Now, what about hormone pills? There's two types of hormone pills that we generally talk about. One is oral contraceptive pills, and oral contraceptive pills, while you're using them, slightly increase your risk of breast cancer, but this risk is really minimal and diminishes after you've stopped use of the pill. The second type of hormone pill is hormone replacement therapy that is prescribed to women after menopause for certain symptoms like hot flashes. Now, this pill certainly increases your breast cancer risk, and so you should use hormone replacement therapy for the shortest amount of time when it's really necessary and under the guidance of your gynecologist or menopause consultant. So what about breast cysts? Now, breast cysts are actually fluid-filled sacs. They are not actually growths or tumors, so they do not convert to breast cancer or increase your risk of breast cancer. Another common problem is fibroadenomas. Fibroadenomas are actually non-cancerous growths. They do not convert to cancer. So if they're growing fast or they're painful, we can get those removed through invisible scars and minimally invasive methods, but not because they convert to cancer. Another common question is about PCOD and breast cancer risk. Now, women with PCOD have irregular menstrual cycles. Oftentimes, it's associated with increased weight, but there is absolutely no evidence to suggest that women with PCOD have a higher risk of breast cancer. Another concern is fertility treatments such as IVF and risk of breast cancer. Now, these fertility treatments often involve use of hormones to increase ovulation, but there is no conclusive evidence to suggest that IVF increases your future breast cancer risk. Now, some of you may have been told that you have dense breasts on mammography, and there's two aspects to dense breasts. One is having dense breasts essentially implies that you have a high proportion of hormonally active gland tissue, and that itself increases your risk of breast cancer. And the second aspect is because you have dense breasts, these can often hide cancers on mammograms. So in women with dense breasts, we use tools such as tomosynthesis, and in some cases we may use additional imaging such as ultrasound or MRI to overcome some of these limitations of mammography. Now, painful breasts is also a common condition. Women often complain of the cyclical pain that comes more before their period, goes away afterwards. This pain certainly does not increase your breast cancer risk. However, if you have pain that is particularly bothersome, unusual, or associated with other symptoms such as a lump, you definitely should get yourself checked. Now, what about women who've had cancer on one side and are concerned about the opposite side? It's important to remember that you are at a slightly increased risk of developing a cancer on the opposite side. So it's important you continue mammography for the breast that did not have cancer and continue to have lifelong follow-up with your oncologist who can monitor you for this risk. So we have discussed these various risk factors. We know that when it comes to breast cancer, there is no vaccine for a 100% prevention strategy, but we know that early detection saves lives. So we encourage all women after the age of 20 to perform self-breast exams once a month. After the age of 30, have a doctor perform a clinical breast exam for you once a year. And after the age of 40, undergo a good quality digital mammogram once a year. Besides this, maintain a good, healthy, active lifestyle with a good exercise routine. Follow a healthy, balanced diet. If you do have a family history that is concerning, do discuss genetic counseling and risk management with your breast specialist. And as always, if you're ever in doubt, get yourself checked out.